there's any distension here, and I do not see any on that side. Can you go ahead and turn your head to this side? Jugular vein distension is not noted on this side as well. So no jugular vein distension. Just kind of lift just a tiny bit up off the table. What I'm looking here is for any herniations, and I do not see that. Okay, you can lay back. So I'm gonna keep your shirt lifted up here for just a second if that's okay. I'm looking at the color of his stomach. I'm looking to see it's nice and flat. I don't see any discoloration. I do not see any masses or any protrusions, any distension noted. Umbilicus is nice and midline, no scarring noted to the belly at all. First thing I'll do to the belly is listen. Do you have any pain in your belly at all?
Nope.
Okay. So, I'm gonna listen to the right upper quadrant, the left upper quadrant, the left lower quadrant, the right lower quadrant. Good. And I'm going to listen with the bell as well. Right upper, left upper, left lower, and right lower. Good. So all of the quadrants are normal, active, and bowel sounds. Just some tinkling heard throughout the stomach, but nothing abnormal there. The next thing that I'm going to do, since I have my stethoscope out, is go ahead and listen to the arteries of the stomach. First thing I'm going to do is do the abdominal aorta. I'm just listening for any bruits. I do not hear any. Now I'm going to do the renal arteries. This is the right and the left renal artery. Now I'm going to do the iliac arteries, the left and the right. And then I'll do the femoral arteries, the right and the left. Good. So no bruits heard in any of those spaces. Nice, good, even rhythm. Now what I'm going to do is just go ahead and percuss your abdomen. What I'm going to go ahead and feel for is a nice tympanic sound throughout. You might hear a little bit of dullness over the stomach and maybe over the liver. Sorry, there's a little tenderness. So good tympanic sound heard throughout. Like I said, a little dullness over the liver. Next thing that I'm going to do is lightly palpate. And what I'm feeling for in this right upper quadrant would be liver enlargement. There is some intestines over here. Do you have any pain? The left upper quadrant would be stomach, spleen, intestines. Do you have any pain there? And then left lower quadrant would be small intestine. Anything there?
No.
And then the right lower quadrant would be for the appendix. And I would also be looking for like rebound tenderness. Do you have any tenderness in that?
No.
Okay, so now I would do some deep palpation. Just looking for any guarding, any distension. Again, looking at that liver, making sure that it's not enlarged. Over here, over the stomach and the intestines. The intestines down here, I don't feel any masses, no tenderness, no guarding. And then like I said, over here, the appendix. So palpating throughout, feels really good, no masses or anything that I've noted. You didn't have any tenderness? Now what I'm gonna do is feel for the liver span and edge. So I'm gonna have you take a big deep breath and exhale. And I'm just gonna feel for that liver under here, which feels really good. No enlargement noted there. Nice normal liver. And then I'm also gonna feel for the kidneys, do some kidney allotment. Good, so I'm pressing on the top and the bottom in this one, feeling for those kidneys. Do not feel enlarged, I don't feel any kidney there. I'm gonna come over here and do this side. Big deep breath. Feeling for that kidney over here on the left side. Do not feel that, no enlargement on that side as well. Okay, next thing that I'm gonna have you do, you can go ahead and pull your shirt down. I can have you go ahead and sit up. I can't remember if I went ahead, when I was percussing your belly, I should have went ahead and percussed your lungs earlier. I don't remember if I did that, so I'm just gonna go ahead and do that now. What I'm looking for is a nice resonant sound throughout the lungs. Good, and then on the back, same thing. Nice resonant sound. Good. So like I said, good resonant sound throughout the lungs noted whenever I'm doing percussion. Now what I'm gonna do is I'll have you kind of move back here, the camera well, Cooper, you can stay. I'm looking at the structure of the spine here. I'm also gonna go ahead and do CVA tenderness. I'm just gonna put my hand here and I'm gonna hit, you're gonna tell me if there's any tenderness.
Nope.
Okay, and if you'll scoot this way a little bit so that the camera can see you, Cooper. Looking down the spine here, starting at the neck, I'm gonna look specifically for C7 and T1, just looking for alignment, see if there's any pain throughout the spine. Do you have any pain down the spine as I feel? I'm feeling that bony process all the way down. It's nice, good, and aligned. No protrusions or anything noted throughout the spine. Now I'm gonna look at the paraspinal muscles. Up here is the trapezius. Just kind of feeling that, palpating it. Is there any tenderness there? Nope. No knots or anything there. The latissimus dorsi is here. I'm just gonna go ahead and feel that. Do you have any pain in that area?
Nope.
So no pain noted on that. The erector spinae, thoracic, I'm just gonna feel here. Have any pain there? Nope. And then down here is the erector spinae, lumbar. I'm gonna feel here. Do you have any pain in that area?
No.
Okay. And no knots or anything noted throughout the muscles in the back. Now what I'm gonna have you do is we're gonna check your cervical range of motion. So I'm gonna have you do flexion, extension, hyperextension. Good. And then I'm gonna have you do cervical rotation and then a lateral bend. Good. So cervical rotation and range of motion is good. I'm gonna have you stand up. We're gonna do the spine now. So we'll do flexion, extension, hyperextension, and we're gonna do rotation and then a lateral bend on this side as well. So good. Good range of motion in the spine and the cervical spine. Do you have any pain with any of those? Good. Next thing we're gonna do is a Romberg test to check the cerebellar function. So I'm gonna have you get your hands out of your pocket, keep your feet still, hold your eyes closed, and we're just gonna check to see if there's any sway in the patient. Good, so no sway noted. Now we're gonna do the pronator drift. So I'm gonna have you keep your arms out, close your eyes, and then we're just gonna making sure that the arms do not drift down. We're gonna wait here for about 10 seconds or so. Good, so no drift there, so those are both good. You can go ahead and have a seat there. Now what we're gonna do is just look at the extremities. Looking at the upper extremities here, I'm looking at coloration, good, nice, appropriate color. We can look at temperature. I've already checked skin turgor. No cyanosis noted to the fingers, no clubbing of the fingernails. Do you have any joint pain? And which one is your dominant hand?
All right.
Good. So I'm also going to check for capillary refill. I'm going to push on both sides on one finger, and he had a good brisk capillary refill, less than 3 seconds on both. The next thing that I'm going to do is just check sensation and then your pulses. If you'll go ahead and close your eyes, I'm going to have you feel this. Tell me if it's soft or dull or
Soft.
sharp. Okay.
Sharp. Dull. Soft.
And then while I'm here, I'm just going to go ahead and check on your legs as well with sensation. So keep your eyes closed.
Dull. Soft. Sharp. Soft.
Good. So good sensation in the upper and the lower extremities. Now what I'm going to do is check your pulses. So I'm just going to feel the radial pulses. Good. Those radial pulses are a 2+, not bounding, but good and regular. No edema, so that would be a 0. I'm going to check your brachial pulses on both sides here. All right, that would also be a 2+. I'm going to go ahead and check the pulses in the feet, which this is the dorsal pedal pulses, which is a 2+, and then the posterior tibialis. I'm doing this on both sides, but so you can see just right here behind this bony process here. And that's a 2+ as well. So all of those are 2+. I'm going to go ahead and do the reflexes in the arm. This is the brachial radialis on this side. So a good movement on that hand as well, or on this hand. I would say that that's a 2+ on that reflex. I'm going to do your brachial first, or I'm sorry, your bicep. Good movement there, so it's a 2+. Now I'm going to do your tricep. Good movement there, so that's a 2+. Same thing on this side, brachial radialis. Good movement there, 2 plus. Do the bicep. Good movement there, 2 plus. And then tricep. Good movement there, that's a 2 plus as well. Since I'm here with this, I'm gonna go ahead and do the patellar reflexes. Good movement there, it's 2 plus. 2 plus there, and then the Achilles. Good movement there, 2 plus. Good movement there, that's a 2 plus. I'm gonna go ahead and do your plantar reflex. So keep your foot still. Good, so we're seeing that toe go in, that's what we wanna see. Good, seeing those toes go in on both sides bilaterally. So good reflexes on both sides. Now we're gonna check your range of motion in your upper extremities. So if you'll go ahead and we'll do abduction, adduction of the shoulders. So do that side. Good. And then abduction, adduction of the shoulder on this side. Good. So good range of motion there. Did you have any pain?
Nope.
We're gonna do the elbow. So flexion and extension, flexion and extension. So do that on both sides. Really good. And then the wrist, flexion, extension, hyperextension, flexion, extension, hyperextension. Do that on both sides. Any pain?
Nope.
Fingers, flexion, extension, hyperextension, flexor, extension, hyperextension. Good. Adduction, abduction, adduction, abduction. Really good. And then the wrist, we'll do radial and ulnar movements. Good. Good. So both passive and active range of motion is good. Freely moves, no crepitus felt, and no pain. The next thing that we'll do is test your strength. So I just want you to push up against me. Good. So I would say that's a 5. Now we're looking at the legs here. There is no discoloration of the legs, no veracity. Edema would be a 0. No cyanosis to the feet, and then the no clubbing of the nails. His capillary refill, we're going to check on both sides. Good. Less than 3 seconds. His temperature is really good in the legs, nice and warm, no moisture. I've already checked his pulses. I've already checked his reflexes. What I'm going to do is I'm going to check vibratory sense on the legs. Tell me whenever you can, close your eyes and tell me when you can feel this vibration.
No.
Okay, and then I'm going to do the same thing on this side.
No.
Okay, so vibratory sense is good on both legs. I'm going to go ahead and check the position of your great toe while your eyes are closed. So just tell me that you can feel this in what toe?
Down.
Okay.
Up.
Good.
Up. Down.
Good. So the position of the great toe is good. He can tell me which side and everything is down. Next thing I'm going to do is range of motion of the legs. So I'll have you lay back. We'll do your hips first. Good. So first thing I'm going to do is extension and flexion of the hips. Extension and flexion of the hips. If you do that on both sides. Good. Good. Now we're going to do adduction, abduction. Do that on that side. And then this side, adduction, abduction. Really good. And then flexion and extension of the knee on both sides. Flexion and extension of the knee. Very good. Okay, you can sit up. We're going to do the ankles. Ankles, we're just going to do flexion and extension of the ankles. And then same thing. Movement of that ankle. Good. We're going to do eversion and inversion. Good. Perfect. And then the toes, we'll do flexion, extension, hyperextension. Flexion, extension, hyperextension. Good movement of the toes on passive and active. And then we'll do adduction, abduction, adduction, abduction. Good. Any pain in any of the range of motion in your lower legs? Okay. So passive and active range of motion is good. I'm going to go ahead and check your strength in your legs. If you'll just push against my arms. Good. So good strength in both legs. I would say the strength in the upper and the lowers are 5 out of 5. The next thing that I'm going to do is a miniature cognitive test on you. I'm going to ask you what your name is.
Cooper Scouts.
And then tell me what today is.
December 1st, 2021.
And then tell me where we're at.
Newburgh, Indiana.
And then what we're doing today.
I had to toe assessment.
Perfect. I'm going to give you 3 words. You're going to remember those words and repeat them back to me. Cat, dog, bird.
Cat, dog, bird.
Okay, good. What's the president?
Joe Biden.
And then what is your telephone number?
270-724-8180.
Perfect. And then can you tell me, can you count back from 100 by 5s?
95, 90, 85, 80, 75, 70, 65, 60, 55, 50, 45, 40, 35, 30, 25, 20, 15, 10, 5, 0.
Perfect. So he was able to do that without any issues. I'm going to have you draw a clock for me, just as big as you can. Perfect. So I'm just going to show the camera. He was able to draw a clock. It looks appropriate. All right. Now I want you to repeat the 3 words back to me.
Cat, dog, bird.
Good. So his memory is good. He remembered all 3 words. The next thing I'm going to do is just give you a little bit of education with you being young. I know last time we talked about just making sure you got enough activity. This time I'm just going to say to make sure you stay really hydrated. I know it's easy to drink Cokes and stuff, but make sure you're drinking plenty of water every single day. And then before you do some weightlifting and everything, making sure that you start small whenever you lift and then gradually go up, but also keep making sure that you're protected and that you're stretching before any activity. Do you have any questions at all today? All right, and then I want to thank you for letting me do the exam. If you have anything that you have questions with or that you need help with, just let us know. Thank you very much.